While we're on the topic of health trends, it seems more and more plastic surgery offices are offering apps like this one, Mod Your Bod. It gives patients a sneak peek on what they might look like before going under the knife. The question is, Dr. Ordon, can these apps replace consults, or are they just more so a way for you to augment the consult?
You know, the answer is no, and I don't mean to toot my own horn here, but I was one of the first to start using computer imaging in 1985. I mean, compared to this, it was so primitive. It was a screen, and you'd use a mouse, and you'd change it, then you would take a Polaroid picture of the screen, and you would hand it to them.
Wow.
So this is not a new concept. I mean, the benefit of being able to show you before surgery what you may look like.
Has technology improved? Has the skill of the computer, you know, gotten a little better in the past 20 years?
Oh, 100% that you can change this, and it's much easier to do. In fact, they have 3D imaging
that's right.
too.
When I actually experimented with it for a story I was doing, we did a new nose for me, and I will tell, and it actually came out in the model, the 3D model, so it was kind of this, you know, one step further. And I gotta tell you, I wanted a new nose.
Well, it can be a very powerful tool. It does not...
Managing expectations, seeing,
yes,
you know,
I mean, it can show what you don't want to overdo. You want to show realistic expectations, and that can come into play. If somebody shows you something you just can't do surgically, then that helps you saying, hey, we can't do that. So you want to underestimate with what you're going to do, but it doesn't replace the consultation because that's just, you know, the doctor-patient relationship and feeling comfortable overall. I think none of you wanted to volunteer for any surgical adjustments.
How you looked.
Well, I stepped up to the plate. I want to see this.
You always do.
What
Your eyes got bigger, your nose got smaller, and your lips got smushy.
That's not good. That's not good. That's all wrong.
That is hot.
The only thing, I don't want to change my nose.
What
the only thing I would
Your
consider,
nose is crooked there.
the only thing I would consider is that better?
No.
Wait, let's look at one more of these.
Look at his bicep and that.
Was that altered?
Buffster. No, look at your muscles.
Was that altered?
Look at your right deltoid. Look how big it is. Your tricep.
I have flabby arms.
That's a muscle, not flab.
Oh my God.
Drew, you're bulky.
Listen, my book, the motto is, the enemy of good is better. Why improve upon perfection, Drew?
Yes.
I couldn't agree more.